Do you have a rectocele or vaginal prolapse of your rectum and you don't want surgery? You have options. One of those options is Kegel exercises done correctly. Most Kegels are not, and we'll talk about that in a minute. I'm the Kegel Queen. I'm a registered nurse, and my name is Alice Adams. In this video, we'll talk about how Kegel exercises can help stabilize or even reverse prolapsed rectum. What are Kegel exercises and how do they help? So here's your pelvis. These bones are your pelvis, and this bowl of muscle here is your pelvic floor. You can see from the inside here, you can see from the outside, just to get you the lay of the land here. You see your vagina, urethral opening, anus. This is the part of the body we're talking about. So this bowl of muscle in your pelvis is a little bit like, you know how some of your muscles, they do their own thing and you can control them, kind of like you don't have to think about breathing, but then if you decide to take a deep breath, you can take one intentionally. And these muscles work kind of the same way, that they're busy doing their thing, but you can also intentionally move them. So Kegel exercises are a very specific way of contracting and releasing these muscles for therapeutic benefit. You can also do other kinds of movements that are good for sex, other kind of stuff, but to do therapeutic Kegels, these muscles must be exercised in a very, very specific way to get the benefits that you want. And in my years of experience teaching women about Kegel exercises, 99.99% of women are doing Kegels incorrectly. Women really don't have the facts about how to do Kegels right. So let's just be super clear that Kegels can help only if you're doing them correctly. So how do Kegels help with Rectocele? If you can imagine the organs in here, right? You've got your bladder in the front, your uterus in the middle, and your rectum in the back. And let's just also clarify a little bit of anatomy. The rectum is the part of the very last part of your large intestine. It's inside your body, and it's called the rectum because rectus in Latin means straight. It's like a straight piece of your bowel. People often are confused between the term rectum and the term anus. The anus is just the part that controls poo coming out or not. This very, very last part of your digestive tract. The rectum is the part inside. When you have a rectocele, a prolapsed rectum, that rectum is not straight anymore. It's bulging into the vagina. It's taking up space, covered by the vaginal wall, taking up space inside the vagina. So, how Kegel exercises help? One of the things the pelvic floor does, among others, but one of the things these muscles do is they hold up your pelvic organs, including your rectum. And if they're not working properly, they can't do their job of holding those organs up. For many, many women, they see improvement when they do Kegels right. And how that works, and these muscles are not the only thing holding up your organs. There are also ligaments that support the organs, your rectum included, from the sides and the top. But these muscles are part of that support. And how Kegels work is by increasing muscle tone so that the support is more firm, increasing muscle mass so that the support has literally more bulk to it. Also, when you do Kegels therapeutically, correctly, the pelvic floor sits higher up in the pelvis, and that helps support the organs higher. And finally, there is this gap in the muscle. I'm going to take part of this outer layer of the muscles off to show you. There's this gap in the muscle called the urogenital hiatus, and when you have a prolapse, it's literally falling through this gap in the muscle. when you're doing Kegels correctly, the urogenital hiatus actually gets smaller and helps to keep the organs in where they belong. To find out more about Rectocele and how Kegel exercises can help, visit kegelqueen.com. I'm the Kegel Queen, and I'm here to help.